What is blepharitis? Blepharitis, pronounced Blepharitis, means inflammation of the eyelid. The edges of your lids turn red or dark in color and become swollen and scaly. Blepharitis usually affects both eyes. It can happen when a skin condition causes irritation, when you develop an infection, or when oil glands become clogged. All of these things can even happen at once. Blepharitis is a term for inflammation, but it can lead to an infection in your eye. However, most cases of blepharitis aren't contagious. They aren't likely to lead to blindness. Symptoms. There are several signs and symptoms of blepharitis. They may include 1. Swollen eyelids and/or greasy eyelids. 2. Red, irritated eyes that itch or burn. 3. Crusting of eyelashes and eyelid corners, making your eyelids stick together. 4. Flakes of skin collecting around your eyes and eyelids. 5. Dry eye or excessive tearing. 6. Excessive blinking. Other signs and symptoms may include 1. Photophobia, light sensitivity. 2. Blurred vision. 3. Loss of eyelashes. 4. Eyelashes that grow toward your eyes rather than away from them, trichiasis. What causes blepharitis? Blepharitis can happen if you have issues with the meibomian glands that produce the oils found in tears, certain skin conditions or infections. Causes of anterior blepharitis. 1. Acne rosacea. Rosacea causes facial skin inflammation, which can include your eyelids. 2. Allergies. Allergies to contact lens solution, eye drops or makeup can spur irritation. 3. Dandruff, seborrheic dermatitis. Dandruff flaking can irritate eyelids and cause inflammation. 4. Dry eyes. Dry tear ducts can alter bacterial resistance, resulting in infection. 5. Lice or mites in eyelashes. Demodicosis. Lice or demodex mites can block eyelash follicles and glands in your eye. 5. One study found that 30% of people with chronic blepharitis had demodex mites. Causes of posterior blepharitis. 1. Meibomian gland dysfunction, MGD. When the oil from meibomian glands doesn't flow freely, you can develop dry eye, which can result in inflammation and infection. 2. Acne rosacea. 3. Dandruff. Diagnosis and tests. How is blepharitis diagnosed? There's no single test for blepharitis. Here are a few steps your eye care provider may take to find out if you have blepharitis and what type it is. 1. Take a health history. The provider will ask about symptoms and other health conditions to determine your risk factors. 2. Do an external eyelid exam. The appearance of your eyelids and intensity of reddening, discharge and swelling will help determine the type and severity. 3. Take cultures of discharge. A swab of eyelid secretions sent to a lab can determine contents, including what type of bacteria is present and in what quantity. 4. Do a tear test. A sample of tears can determine if dry eye is a contributing factor. 5. Do an eyelash exam. Evaluating eyelashes under a microscope can detect mites. 6. Perform an eyelid biopsy. Rarely, your provider may need to do a biopsy to rule out skin cancer or other abnormal cells. 6. Your eye care provider will numb your lid with local anesthetic. 6. Then they'll use a needle to take a sample of cells to examine under a microscope. 6. You may bruise, but you're not likely to have a scar. Management and treatment. Can I treat my blepharitis at home? For some types of blepharitis, self-care at home may help soothe the symptoms. If you believe you have blepharitis, try these tips. 1. Avoid eye makeup. To lessen irritation, you may want to avoid eye makeup until the inflammation is managed. 2. Use warm compresses. Take a clean washcloth and wet it with very warm water. 2. Wring out excess water, and place the cloth over your eyelids. 2. Repeat this as necessary to keep the cloth temperature constant. 2. Eventually, the crusts will dampen and oily debris will be easier to wipe away. 2. Commercially available microwavable heat masks can hold heat longer and may be more effective. 3. Get some omega-3s. Some studies have found that omega-3s, found in fish or flax seed oil, will help the glands in your eyes work better. 3. Eating green, leafy vegetables and avoiding high-fat foods can also be helpful. 4. Lid scrubs. These are available over the counter as a spray, foam or individually wrapped towelettes, often containing hypochlorous acid. 4. They help reduce dandruff on your lashes and the bacterial numbers on your eyelid skin. If you are new at our channel, please subscribe our channel. It will be great support for us.